Welcome to the TMI Doctor, talking all things TMI and health and wellness. Here's a highlight from today's episode.
If we're going to have to create some kind of like category to understand trauma, I think it's much more appropriate and accurate to say if it was personal or impersonal rather than big T or little t,
That's a good
because
point. Yeah.
personal trauma and impersonal trauma have very different effects on people. So impersonal trauma is like a car accident. It is a natural disaster. It's war. But personal trauma is an assault. It's a betrayal. It's someone you knew hurt you. And like I said, 90% of women's trauma is personal.
Yeah.
So when you go through personal trauma, it deeply affects your sense of relationships, of trusting your own judgment,
Yeah.
right? It derails all of these things very differently than the impersonal trauma. Yet we've studied impersonal trauma, and that's what most of our texts focus on, which does women a big disservice and is another form of trauma that a woman's need is getting so systemically ignored.
Hi, I'm the TMI doctor, Dr. Tanya Yannick, and I'm here with Cassie McCarthy, trauma therapist. I wanted to have her on because I have a lot of patients that deal with big T and even little t trauma that they don't even know about. So I thought she would be a great resource to have on here, and also you'll be able to find her once we're done with this talk. So Cassie, tell me more about you, what got you into this, what your background is, all that jazz.
Well, thank you first for having me on. I really
Or
appreciate it. And thank you to everyone watching. I think I was kind of destined to be a therapist and to do this work for as long as I can remember. I really wanted to work with people and to help people. And when I got to college and I started taking psych classes, I was like, yeah, this fits. This is the right thing.
Mhm.
And just like immediately in my career, I noticed the clients that I felt the most energized to work with, the most excited to work with, the most passionate to work with are clients that I was helping recover from trauma and PTSD.
Yeah.
And so, right from the beginning, it was just what I was really excited for. And then over the years, I just decided to keep doubling down on it and,
That's great.
get
Yeah.
certified in trauma protocols and different trauma therapies. And nowadays, I really mostly work with women who have trauma and PTSD, which is how we connected because I think that our clients have a lot of overlap.
Yeah.
A lot of women with trauma do tend to have pelvic floor struggles and vice versa. Um, but I feel like it's hard to say like what got me into it when I feel like it does not sound cliche, but it's almost like a calling. I can't do
Oh,
anything else enjoyably. Like I've tried doing other kinds of therapy and I just don't love it the way I love this.
yeah.
So that's kind of what got me into it, I
Great.
suppose.
Yeah, I totally feel that it's a calling because, I thought about going into PT, and then, a former roommate was like, "You should look into pelvic PT." And then ever
Yeah.
since then, it was just like little seeds. Like every time I thought I was getting away from it, it just pulls you back in. And like I never
Right.
understood that, but then
Yeah.
you're interested in it, and just the universe just keeps on putting that like in your path, and you're just like,
Right.
I guess this is just what I was supposed to do. Okay,
Yeah.
I'm just
Yeah.
gonna stop fighting
Yeah.
it.
When I've tried doing other things, I just didn't
Yeah,
feel the
yeah,
same. Like
yeah.
that I'm just so passionate about it. So you know, don't fight it. So just I'm going with it.
Yeah, that's great. Yeah, having you on is great because I mean, obviously there's so many people that I talk to that have, trauma, but what I'm also finding, and I wanted to get your thoughts on this, we know about the big T. So, for people that don't know, big T trauma is like the big bad obvious events that,
That
cause PTSD.
society validates as
Yeah, yeah,
trauma.
exactly. Yep.
Natural disasters,
Yeah,
war,
yeah,
sexual rape,
yeah,
that society validates. Yeah.
yep. Um, but what I notice I'm seeing is I have a lot of women coming in that they're presenting like trauma patients that swear they're like, I don't know why I'm acting like this. But then I hear about their lives and it almost sounds like, I don't know if it's is societal trauma a thing, like the microaggressions, or just a lot of them are kind of the women are conditioned to be people pleasers and to always be caretakers. And I noticed that there's this underlying, like the women are, but I have to. That's my favorite is I have to do this. I have to do that. I have to, there's birthdays. I have to take care of this. It's the holidays. I have to take care of that. And I'm like,
Yeah,
okay, they're holidays and birthday, and not to say like we shouldn't celebrate anything. Obviously, we want to celebrate things, but
sure.
I feel like I'm just noticing this thread of women kind of presenting with PTSD like symptoms where they cannot, their nervous system never rests.
Yeah.
I
Yeah.
I want to know your thoughts on that. What kind of
Uh,
contributes to that heightened nervous system when there isn't the big T trauma going on?
well, so I don't even consider big T or little T traumas in my work. Like I
Really?
just consider,
Okay, that's
oh,
awesome.
I don't see it in that way.
Great.
I feel like it's helpful language for when I'm talking to other people for them to understand, but it's not actually clinically helpful in my work.
Yeah.
Um, so I just define trauma. And in fact, I don't even define complex trauma because
Okay. Yeah.
by nature, PTSD is complex.
Yeah. Good
Um,
point.
so the way I go by the definition of trauma, and then I kind of go into it very deeply. So the textbook DSM
Hmm.
definition of trauma is real or threatened,
Hmm.
death, injury, or violation to yourself or someone you love. And so when we look at that in fine detail, real or threatened death to yourself or to someone you love can look like a lot of different things. It can be explicit acts of violence, but
Hmm.
it can also be coercion, manipulation, you
Yeah.
know, threats to your reputation, forms of control over your autonomy, things like that, that we would call little t, but I see it as a real or threatened death activity or real
Okay. Yeah.
threatened
Interesting.
injury or
Yeah.
real threatened violation. So when I look at it from that lens, I'm able to see things like betrayal as a form of trauma
Yeah.
because that's a violation. So that's how I go about looking at it. And that's how I go about assessing, did this person experience trauma?
Hmm.
And from there, if they've experienced trauma, we can then understand that now their nervous system might be affected and to what degree is it affected. And that's when we look at PTSD.
Yeah.
And the number one predictor of a traumatic event becoming PTSD is not if it's big T or little t. That's irrelevant, actually. We know,
Fascinating. Okay.
yeah, the number one predictor of the event becoming PTSD is the person's perception of their support system after the event.
Yeah. And I think I noticed that the women that present like this, they have very little support system. I'm noticing. Yeah. So that's one thing I try to recommend is
Right.
do you have friends you can ask? Do you have family members? And I mean, almost unanimously, they're always like, well, I guess I feel bad asking for help.
Yeah.
It's
Well,
wild. Yeah. I'm like, but ask for help. Oh my
so
gosh.
let's even just like look at the term PTSD, right?
Yeah.
Post trauma, after you went through the trauma, which we now have redefined, that can be a lot of things.
Yeah.
You have a stress disorder, which means your body isn't processing stress. Your body is not
Mm.
able to differentiate stress from threat any longer.
Yeah.
And it treats all stress as a form of threat. And so it's constantly responding to things as if it's a threat, as a way to keep you safe from being re-traumatized.
I would
So
joke with my patients. I'm like, your nervous system doesn't know the difference between tigers and bears and COVID and taxes. I don't
yeah,
know if that's
it
accurate, but
doesn't.
yeah.
But we can actually treat people so that their nervous system can't differentiate between those
Okay,
things.
gotcha. Yeah.
We can differentiate from it with the right support and the right help. But a person who's gone through trauma, especially if it's been repetitive trauma,
Mhm.
they begin to learn that they're on their own
Yeah.
and they can't rely on people for help. And that if they don't do it, it's not going to get done.
Yeah.
So they do have to do these things because if they don't get them done, it's not, you're right, like these are the things they learn. And so they develop these patterns that kind of get stuck that then don't get updated once their life has changed. They don't see that the pattern they learned needed to survive when they were younger might not be necessary anymore, but they're still stuck in that pattern. And we have to kind of update the way their brain processes these things.
Excellent. Yeah, that's definitely in line with what I've been seeing. And I want to help these people. And I try to ask them questions like, can you simplify your schedule? Can you ask for help? Can look for, a support network or create a support network? I had someone that, I think parents actually almost go through it because,
Yeah,
they don't have a lot of support. They're trying to get through a lot, and they're just trying to get through every day. And
right.
the ones that seem to thrive are the ones that seem to, link up with other parents to create these like
The
babysitting things.
villages.
Like
Yeah,
yeah. And the ones that
right,
are like, I could do it all are just, I tell them, I'm like, your nervous system is redlined. And it's
right.
just this double-edged sword because then I'm like, okay, well, I try to make it sustainable. Like, yeah, we can't go meditate for an hour and go work out for an hour. But I'm like, can you find moments to, take a breath and do a stretch and do a
Yeah.
little snack size self-care? And a lot of them, their response is, well, I don't have time for that because of all the things that, and I'm like, it's
But
this like,
they might not have
yeah,
time for it. Or what I often see is that hyperproductivity is a drug.
yeah.
It's a
Oh,
drug of choice
definitely.
for people, right? Some people, so one of the things that happen after trauma is you want to avoid thinking about it. It's very overwhelming. And hyperproductivity is a very effective way to avoid thinking about it. So
Hmm.
people become really productive, but also after the traumatic event, they might begin to think that, oh, it happened because I didn't stop it, or it happened because I didn't prevent it. So then they begin thinking, well, I have to control these things so that I can prevent bad things from happening. And so
Yes.
then they do become hyper productive because they think it's a way to protect themselves. And the idea of taking that productivity away is really scary, and it
Hmm.
feels like they're losing control. And so that's part of the pathways we have to rewire, because they develop these thinking pathways, these neurological pathways that came out of necessity, but they're not helping them anymore. And we need to update them.
Yeah, definitely. So
Yes.
I mean, obviously we're not going to do a treatment online or anything, but could you get like if someone was considering like, I don't know, am I someone that needs this kind of therapy? Is there something that like a little litmus test that you can say if, this might be why and here's maybe what to expect, in therapy? Because I think there's a lot of different types of therapies and,
Yeah.
they're like,
Yeah.
I'm
Right.
not sure what to expect.
So I think the first thing would be to really open your view of what the definition of trauma really is.
Hmm.
We're trained as a society, and even clinicians are trained to understand it through like a very male-centered model
Yeah.
of these big T events, war, car accidents, things like that. But the truth is, most people with trauma are women.
Hmm.
3 to 4% of men have PTSD, 10 to 12% of women have PTSD. So there's a really high chance that a woman has PTSD and she doesn't even realize it because she might not recognize what she went through as trauma. So I would say the first thing is broadening your definition of trauma. And I'm putting together a new kind of trauma checklist. The
Hmm.
ones that are out there are very much male centered in those big T events, and even the ones that like could be more gender neutral or more female friendly, they only talk about high levels of violence.
Gotcha.
Whereas a lot of trauma that women go through might not have been violent. It was probably violating. 90% of women's trauma happens when someone you thought you could trust hurts you.
Yep.
And maybe it was a physical harm, maybe it was an emotional harm, maybe it was a sexual harm, maybe it was a financial harm, maybe it was a social harm, right?
Hmm.
So we have to first broaden how we're defining trauma. And then we have to ask ourselves, do I live in a way that makes me terrified of this event happening again? And
Mm,
do I live in a way that's set up to protect me from it happening again, to myself or to my kids?
yeah.
Because that's what happens once you start having kids. You start becoming really worried anything bad could happen to your kids.
Yeah.
And so if you're saying yes to that, you might be responding to trauma. You might be having a trauma reaction. So if you are, you're going to want to get trauma focused therapy. And this is where a lot of people get confused because they think that they can go to a therapist and get what they need, and they can't. Trauma is a specialization.
Hmm.
So you're going to need a trauma focused therapist. And so you might start looking for trauma therapy, and you're going to hear therapists say, I'm trauma informed, I'm trauma informed, I'm trauma informed. Trauma informed is nice, it's lovely, but it only means they're informed about what trauma is and how it affects people, but they're not specifically trained to treat trauma and PTSD. They're trained to kind of help you de-escalate when you're triggered, to help you cope, to help you ground. And I tell my clients all the time, I don't want to help you cope with trauma. Well, that sounds like a terrible way to live. I want to help you recover from it so that it no longer debilitates you and it no longer limits what you're doing in your life. So
Got it.
finding a trauma focused therapist is entirely different. When you're seeing a trauma focused therapist, they're using one of three evidence-based practices. We have three, which is great,
Mhm.
but anything outside of these three is not proven to be effective for
Got it.
trauma. I use something called cognitive processing therapy. It's one of the practices. Another one is called eye movement desensitization and reprocessing, or EMDR.
Yep,
It's
that's a biggie. I've heard a lot
well,
of
yeah,
people
I
talking
mean,
about that. Yeah.
yeah, celebrities have used it, and so they talk about it. So that one's gotten famous. And the third one that doesn't get a lot of attention is called prolonged exposure therapy, and it's
Mm.
also very effective. Think about exposure therapy like this: you're avoiding your fears, and exposure therapy teaches you how to slowly begin to address them, so that you're not afraid of them anymore, and you can take back your life.
Yeah.
Right? EMDR is about teaching you to think about or discuss your trauma while pairing it with a stimuli, something you can see, hear, feel. So that way you're using two different regions of your brain at the same time. And in doing so, you're able to pair the memory with something that's more grounding and relaxing. So when you do recall the memory, it doesn't trigger the same physical response anymore.
Yeah.
Cognitive
It almost
process.
like stores it in a different, like kind of
Well,
reimagines it.
kind of. What we say is what fires together wires together. So if
Yes. Yeah.
things happen at the same time, you're going to associate them with each other. And so if we can begin to associate the trauma without fear, it no longer triggers fear in you.
Yeah.
So it just kind of rewires that association. And then then what I do is called cognitive processing therapy. And it's different than the other two therapies because with CPT, we don't ever need to talk about what you went through. Like
Oh,
with
nice. Okay.
exposure to EMDR, you're going to discuss it.
Yeah.
With CPT, we don't need to discuss it ever. What we're looking for is how your brain processes things now, right? Like I said about earlier, one of your clients might be thinking, well, it happened because I wasn't in control. So that's how their brain processes threats of danger now. A threat of danger is anything associated with not having control.
Yeah.
And so what we do is we find how your brain kind of made sense of the world after the event and how that reshaped your thinking patterns. But more importantly, I teach you the therapy. I
Hmm.
teach you every skill I'm doing. So that way, between sessions, you have the
Yeah.
skills and then you don't need me. So you can go to the gas station and pump your gas, which is a huge trigger for a lot of women. Women are often very
Really?
scared at the gas station. Yes, it's a very common one.
Oh my gosh, I didn't even, well, and that's true because sometimes you're pulling off to a dark like area and
A
you're
dark
scared.
area, there might be men around, you feel
Mhm.
scared, you feel vulnerable, right? It's just a triggering one
Hmm.
without having that intense fear anymore.
Yeah.
And so you can be at the gas station, you can be pumping your gas, and you can be using your skills to be like, I have real control now. And what I tell my clients is the moment you're trying to grasp for control is the moment you're out of control. So I need to
Mm.
teach you how to actually be calm. And that is your real control, and how to actually feel at peace with that. So we kind of rewire how your brain is perceiving threats of danger, because that's what it is. Your brain goes into overdrive saying, that's a threat, that's a threat, that's a threat, that's a threat, because your brain would rather err in the side of caution
Yeah.
than leave you vulnerable and exposed. But what happens is your brain kind of overcorrected.
Yeah.
And so with CPT, we recalibrate your brain, because I still want you to respond to danger appropriately. I still
Yeah.
want you to look both ways when you
Yeah.
cross the street,
Yeah. I
right?
was
Like
like, we don't want to go the other way.
I still want you to have an appropriate response. I just don't want it firing nonstop and all the time. And so I teach you how to recalibrate that, and then we generalize it to the rest of your life, which is
That's great.
safety, trust, power and control, esteem, and intimacy. So that way you're able to really take back your current and future life, and people are able to have those skills for the rest of their lives. And so what's really cool with CPT is that because it's so thoroughly researched, we know how to roll it out very effectively and very efficiently. So now we can roll it out in 12 sessions.
Oh, nice. Okay, so that
Yeah,
can be so you're not like in because I know, a lot of people are in talk therapy for a long time, and it's good to have
yeah.
someone to talk to, but I know that's not gonna solve the trauma.
Right, right. That's one of the big myths about trauma therapy is that it takes a long time to heal. No, actually, no.
Great, yeah.
You see the results quite rapidly with CPT. And then another really cool factor about it is because you learn the skills. Once you're in a recovery zone, and we know when you enter that zone, once you're there, you're not expected to ever leave there again because you have the skills to fix it as you go. So there have been long-term studies on CPT where people were followed up 6 months later, 5 years later, 10 years later, and people maintain their progress or continue to get better. And the
Great.
way we monitor it, and I do this with my clients every week, is there's an assessment tool that monitors your trauma symptoms. And we
Mm.
can see every week in a graph, you get better, you get better, you get better. And so people get a lot of reinforcement by actually seeing their scores improving and that
Oh,
they're
that's
getting
great.
better. Yeah,
That's
it's pretty,
awesome. Yeah,
yeah.
so to see that that has to be rewarding to be like, 3, 4 months down the road, they're like, I feel safe going, to wherever was triggering.
It's really like shocking to them and it's mind-boggling.
Yeah.
Like I had a client tell me the other day, like, her former abuser got her phone number and called her and she wasn't triggered. And
Oh
she's
my
like,
gosh.
there and was like, what does he want? And it didn't spiral her. And
Yeah.
it didn't do anything. She was just like, ugh, and just like blocked the number.
Yeah.
Like,
That's fascinating. That's great. That's amazing.
yeah,
I know that's not
right,
the case for a lot of people going
right.
through this sort of stuff.
Yeah, I don't want you to cope with that. I
Yeah.
want that to no longer trigger you. So
That's a
that,
beautiful reframe of like people are like, how do I deal? Because it almost feels like a something that will never ever go away. So this is a refreshing
yeah,
look on
yeah,
that because most people think it's just a ongoing
right.
condition. Yeah.
The memory will never go away, but what we can do with the memory is we can restore it in a healthier part of your brain so
Hmm.
that you can control when you remember it, what you're remembering, how long you remember it for, and how you feel when you remember it.
Yeah.
Because before the therapy, it feels like the memories are intruding in your life and they're just kind of coming in and flooding and taking over, and then you feel powerless.
Yeah.
This isn't Men in Black. I can't wave
Yeah.
something in your
Yeah. It's not going to go away.
memory. But I can give you control over your memory and control over
Great.
your thoughts.
That's
Yeah,
great.
it's really cool.
Is there any myths you want to bust? I mean, I think we kind of did that, like, you don't have to live with, these symptoms forever and that,
Yeah.
you don't have to have a major event. I have a theory that most women have some sort of, trauma just because there is a lot of, we're told one thing and then our life experience is something else. And it's almost like constant
Yeah.
gaslighting. Like
Yeah.
we're told to do this, but then we can't ever do it right. And then we're in
Yeah.
relationships that are like, there's mini betrayals. Like I always hear the women say, well, I can't let him do it because it won't get done. And I don't know how much that is true. I mean, and
Oh, the weaponized incompetence is real.
yes, I don't want to throw people under the bus, but I'm like, it's pretty rampant as far as I can
It's pretty
tell. But
real. Yeah,
but
no,
it almost feels
but
like that is,
but
some,
let's also validate that neglect is abuse,
yeah,
right? Like that neglect is a form of abuse, and a lot of people do feel neglected in their relationships and in their marriages and in their families, and that feels very isolating and very lonely. And the truth is, women do experience trauma at much higher rates than men. Sure, men can go through trauma, but women are experiencing it in much higher rates. And if we're going to have to create some kind of like category to understand trauma, I think it's much um, more appropriate and accurate to say if it was personal or impersonal rather than big
mm,
T or little t.
that's a good
Because
point. Yeah,
personal trauma and impersonal trauma have very different effects on people. So impersonal trauma is like a car accident. It is a natural disaster. It's war. But personal trauma is an assault. It's a betrayal. It's someone you knew hurt you. And like I said, 90% of women's trauma is personal.
Yeah.
So when you go through personal trauma, it deeply affects your sense of relationships, of trusting your own judgment,
Yeah.
right? It derails all of these things very differently than the impersonal trauma. Yeah, we've studied impersonal trauma, and that's what most of our texts focus on, which does women a big disservice and is another form of trauma that a woman's need is getting so systemically ignored.
Yeah.
And we know for a fact that 1 in 2 women experience some form of sexual violation in their lifetime.
Yeah.
It might not be a rape, but it was a sexual violation of one kind or another. And that can form trauma.
Mhm.
And I have women tell me all the time, well, I don't think it was really a trauma because it wasn't violent.
Yeah.
Well, violence isn't necessary for trauma. Violation, though.
Yeah.
Did it feel violent? Did you feel like no was an option?
Mhm.
Was consent asked for? Right? Because, right. And when they can start to see, like, oh, I was violated. And the reason I didn't fight, because they blame themselves, well, I didn't fight. I didn't really say no. I didn't really, well, because you went into freeze mode. And freeze is just as valid as a fight response. And we know that we can't change if you go to fight or if you go to flight or if you go to freeze. We know that if you're leaning towards one or the other, it's just your hard wiring. And we
Yeah.
know this because the United States military has poured millions of dollars trying to override which direction their soldiers go into. And they figured
Mhm.
out that they couldn't.
Interesting. Okay.
They can't. That's why, like, these boot camps and these Navy SEAL trainings are so intense because they need to weed out the different responses,
Yeah. Yeah. That makes
right?
sense. They don't want that to happen in actual combat. They're like, let's put them in high stress situations before they even go into that situation.
Yeah. And so if you're going into one of these directions, it's just your hard wiring.
Yeah.
And it plus your amygdala makes a snap decision in a millisecond, 0.25 seconds, a snap decision of what to do based off of what your options are and what's the safest. So if you're a 5'4" woman who weighs 140 pounds soaking wet, and there is a 6 foot tall man weighing 210 pounds, you're not going to fight him.
Yeah. So you're
You're not
gonna
going
go.
to flight.
Yeah.
You're going to freeze. And then it's going to feel very violating. And then you're going to blame yourself and you're going to say, well, I didn't say no. Okay, well, was consent asked for?
No, no, it's rarely. And what I see a lot is relational, like these, I don't know what you want to call it, these like little betrayals, throughout like their relationship is
Yeah.
they'll feel bad that they're not having enough sex, but it's because the sex isn't pleasurable. There's no floor play. There's no, you know, connection
Yeah.
or anything between the instances of intimacy. She's exhausted because she's doing all the, childcare while he's out doing who knows what. And then
Yeah.
comes home and wants to get down, and she's just like, rah.
Right.
And then then she gets gaslit into thinking she's the problem. And then she's in my
Right.
office trying to fix herself. And I'm just like, is there any recommendation of like how, because I think there's a lot of cognitive dissonance, like of this is what it means to be a good mom, good wife, good friend, good sister, good daughter. And they're just, it's almost like I don't want to, I'm not going to victim blame, but like the abandonment of self is almost like a repeated betrayal. And also because they're in these situations that they're in
Yeah.
the cycle. And I try to ask them questions. I don't want to, trigger anything while we're in the office, but I always ask how do they have a mental health provider, but now I'm starting to think like even though it's not a big, let's get rid of big T, it sounds like it's personal, little like, instances throughout their days, their weeks, their months, their years that are
Which
adding
is
up to this.
insidious because it then reinforces the belief I have to do it on my own. I'm all alone. If I say no, people are going to be upset with me. I
Yep.
must be pleasing to keep people around me, right? It reinforces
Yeah.
those beliefs. The chronicity of it
Yeah.
makes it very painful. It makes it very difficult. And what you're describing feels like almost coercive.
Oh, very. That's what I'm hearing a lot of in my office. And I don't
Right.
know how to, I try to very gently, because
Right. So
I don't want to
trauma,
send them into like a,
right. So a trauma-informed provider should never
yeah,
name it because like you can't contain it, right? You don't know how to contain that trigger.
yeah,
So I have no problem naming it with my
yeah,
clients. I know how to contain them.
yeah,
But but if you don't know how to contain it, it's really a matter of validating and support and
right.
believing them and
Mhm.
listening to them and saying, hey, what I'm seeing in you looks like a trauma response,
Yep.
right? And trauma can be just as simple as living in chronic pain.
Yeah. Oh, yeah. I see that a lot too. Yep.
Right. And so it looks like you're living in chronic pain, and that's really painful emotionally.
Mhm.
And then redirecting them, right? Like if you think
Yeah.
about it, a PCP can notice if there's a heart problem going on, but they still have to send you to a cardiologist for
Yep.
the proper diagnosis and assessment and treatment of it. And so that's what you would be doing. You'd be redirecting them basically to be like, here's the cardiology department.
And that's where
I,
you come in. I
yeah,
say, I have this
exactly.
great provider you should talk to.
Exactly. And what I say to clients all the time is like, it's really hard to feel sexual desire
Yep.
when you feel disgust.
Yep. And I'm like, yeah. And I'm always gently treading that line of like validating and saying,
Yeah.
I could see the frustration. It's hard to get going, when you don't feel
Yeah.
supported and all of these.
But you're also not going to enjoy sex when you're under that much stress.
Yep.
Because whether you're in fight, flight, or freeze, it doesn't matter. Your body is in a clenched state.
Yep.
And you can't enjoy sex in that state. It's not going to be fun. It's not going to be pleasurable
Nope.
in that state.
Throws on the brakes, as I like to say.
Right. And what fires together wires together. Your brain is now associated sex with not feeling good. And so
Yep.
now even just the idea of sex can feel aversive. And people develop sex aversion as a result. And then they feel like there's something wrong with me because I'm supposed to want sex. I should want sex.
Oh,
Well, you probably do want sex if we widen the umbrella term of what sex is. But if we keep it as a very narrow heterosexual concept of penis entering a vagina, that might
yep.
not be pleasurable because most women aren't even going to orgasm from that. But if we were willing to open the umbrella to all the different types of sexual behavior and your partner was willing to do those things, maybe you would enjoy sex again.
Amen. Hallelujah. Not that I'm religious, but
Yeah.
yeah, I love, yeah, all of these things. And I see it a lot because being public health, they're coming in trying to, a lot of it is their sexual health that they're trying to address. And
Yeah.
I see these bigger issues that I'm like, oh, this is outside my scope, but I don't even think they realize it yet. So creating
Yeah.
that space and having that discussion. But so
Yeah.
speaking of creating that space and getting these women this help, and maybe if someone listens and says, ooh, that might be me,
Yeah.
where can they find you, so that maybe they can make
Yeah.
an appointment or just even see your content?
Yeah. So I have a website. It's CassieMcCarthy.com, and there's tons of information on there. I have a blog on there that gives a ton of information. You'll see downloadable things that you can learn more and read more on. So it's probably the best kind of like central place. And from there, if you ever want, you can go on any of my socials and I have information on there. I am licensed in Massachusetts, Vermont, Virginia, Illinois, and soon to be Florida. So
Ooh,
if you're in one of those states, you can feel free to book a consultation call with me and we can talk about what you're looking for and if I'm the right fit for you, and we can go from there. But if you're not in one of those states, there's still tons of information you can still gather from there.
yeah, I've been watching your social media content, and I've even had little light bulb moments like, oh my gosh, you're so right, I didn't even think of that. But so
Thank
yeah,
you.
I love learning from my fellow colleagues because we all can't
Me
be
too.
specialists in every single thing in every single, field.
Absolutely.
So it's always
Yeah.
these,
Yeah.
I call it adjacent, my care providers. It's just fun to
Yeah.
have these discussions. And
Yeah. Well, there's just a lot of overlap. Like I specialize in sexual trauma and I need to have pelvic floor PTs I work with because as much work as I can do, if the muscles are frozen tight, the muscles are frozen tight.
when they're in fight or flight, man, they're like locked
Yeah.
down.
And even after they recover, it doesn't mean the muscles are suddenly like, look at me. No, it's a muscle that needs to be retrained. We
Yep.
retrained the muscles in your brain, even though there's
Yep.
not muscles in there, but we retrained it. Now you need to train the muscles in your pelvic floor.
Yep.
So there's always a lot of crossover in pelvic floor PT and what a therapist does.
Definitely. Well, I
Yeah.
appreciate you. I appreciate you coming on today. I appreciate the work you do because it
Thank
is
you.
much, much needed because a lot of people need it. We got to deprogram a lot of,
Thank you.
assumptions and things going on. So thank you
Yeah.
so much for coming on
My
and
pleasure.
hopefully some people learned something new today. Have a great one.